Hello. Welcome to this exploration of the human body. We are about to embark on a journey, not across the cosmos, but into an equally intricate universe, ourselves. Our guide on this journey is a science called gross anatomy. Today we would be talking about the divisions of gross anatomy. There are 7 divisions of gross, which are 1. Regional anatomy. Let's begin with regional anatomy. We are talking about organs, bones, muscles, and vessels. These are the continents, mountains, and rivers of the human form. Understanding this macroscopic world is fundamental for health professionals. It is the foundational map upon which all medical knowledge is built. Let's begin our first major navigational tool, regional anatomy. Regional anatomy divides the body into distinct geographical areas, or regions: head and neck, thorax, the chest, abdomen, pelvis and perineum, back, upper limb, and lower limb. When you study regionally, you focus on one territory at a time. Within that region, you learn every structure, from skin to bone. Think of it like being a city planner mastering one district. You would study the roads, buildings, parks, plumbing, and the electrical grid. For the arm, the humerus, the biceps and triceps, the brachial artery, the radial nerve, the ulnar nerve, and the skin. You learn what lies superficial or deep, anterior or posterior. It is practical for anyone who physically interacts with the body. A knee surgeon must know the popliteal artery, the course of the peroneal nerve, and the knee ligaments. Now, let us shift our perspective and explore systemic anatomy. Where regional anatomy is geography, systemic anatomy is function and collaboration. This approach organizes study around organ systems, organs working together to perform major functions. There are typically 11 recognized organ systems: skeletal, muscular, nervous, cardiovascular, respiratory, digestive, endocrine, and more. Studying systemically is like tracing a single highway across the country, like the global shipping network. From origin to ocean crossings to final destinations. For the respiratory system, the nose and pharynx, the trachea into the chest, bronchi and lungs, all to achieve gas exchange. Form follows function. Systemic anatomy helps us understand how the body works. Heart, the pump; arteries, the distribution network; capillaries, the exchange sites; veins, the return network. Blood is propelled, oxygen delivered, waste removed. Mouth and salivary glands, esophagus to stomach, small intestine to large intestine, rectum and anus, with liver, gallbladder and pancreas assisting. Together they form a cohesive production line. Key question: which structures work together, and how? Surface anatomy, living anatomy, studies external features and their links to deeper structures. It is anatomy by sight and by touch, palpation. Visible bumps, curves, and hollows are not random. They are landmarks. These landmarks hint at organs, bones, and vessels beneath. Like a navigator before GPS, you rely on stars, coastline, and currents. Surface anatomy is the clinician's navigation. Press a point on the abdomen, find a vein for an injection, assess a joint's motion, all guided by surface landmarks. It transforms the body from opaque surface into a translucent map. Example: the bony bump at your wrist is the styloid process of the ulna. The pulsing spot in your neck marks the common carotid artery. Find the suprasternal notch. Slide down to the sternal angle, a crucial landmark. Here, the second rib begins. The trachea bifurcates, and the aortic arch begins and ends. Surface anatomy guides stethoscope placement and safe needle entry. A non-invasive way to see within. A simple bump outside reveals a detailed story inside. Clinical anatomy, applied anatomy, asks how structure explains signs, symptoms, and safe treatment. It is a way of thinking that links anatomy to real patients. Like a master mechanic, know each part, how it can fail, the symptoms, and the precise repair. A fracture can injure a neighboring nerve. A blockage in a specific artery yields a specific symptom pattern. Safe surgery respects anatomical planes and vital structures. Anatomy through the lens of pathology, diagnosis, and intervention. Pain and numbness down the back of the leg points to the sciatic nerve. Know its route from lower back through the buttock and down the leg. Consider compression points along the path, often a herniated intervertebral disc. Anatomy guides the physical exam, imaging choices, diagnosis, and treatment. The inguinal canal is a natural weak spot in the lower abdominal wall. In males, the spermatic cord passes here, explaining common inguinal hernias. Detailed boundaries and contents are essential for safe hernia repair. Clinical anatomy connects knowledge to healing. Radiological anatomy, seeing the unseen. Technology lets us peer inside the living body without a single incision. We study anatomy as it appears on X-rays, CT, MRI, and ultrasound. These images reveal bones, organs, blood vessels, and soft tissues. We translate grayscale slices into a three-dimensional understanding. Bone is bright on X-ray and CT, air is black. MRI excels at soft tissue contrast. MRI beautifully displays muscles, ligaments, and brain matter. Radiologists identify tumors, fractures, internal bleeding, and infections. Surgeons plan safer, more precise procedures using imaging. A CT of the abdomen produces detailed cross-sectional slices for a virtual tour. At one level, liver, spleen, and kidneys. At another, the pancreas behind the stomach, the aorta, and inferior vena cava. This non-invasive window has transformed medicine. Cross-sectional anatomy studies the body in slices, like slicing a loaf at any level. Axial divides superior from inferior, sagittal divides left from right, coronal separates front from back. It demands a strong three-dimensional mental model. Cut through the chest, at heart level, or the head at the level of the eyes. You see exactly which structures are neighbors at that depth. Modern CT and MRI generate images precisely along these planes. Reading a scan is reading cross-sections in sequence. At the umbilicus, posteriorly, a lumbar vertebral body, then the aorta slightly left, the IVC slightly right, loops of small intestine in front, wrapped by the abdominal wall muscles. One slice can guide imaging interpretation and safer surgery. Comparative gross anatomy takes a broader view across species. By comparing anatomical similarities and differences, we learn function, adaptation, and history. Compare the heart of a fish, a reptile, another mammal, and a human to reveal design principles. Like studying all vehicles, fundamentals versus specialized adaptations. Forelimbs share a common blueprint, one humerus, two forearm bones, radius and ulna, wrist carpals, and the hand phalanges. This homology signals shared ancestry while proportions adapt for grasping, walking, swimming, or flying. Seeing extremes in animals can clarify purpose in our own anatomy. It underpins veterinary care and enriches human medical understanding. We have explored gross anatomy through 7 interconnected lenses. Each offers indispensable insight. True mastery comes from synthesizing them into one cohesive understanding. Regional, study by body regions. Systemic, study by organ systems. Surface, external landmarks. Clinical anatomy applied to care. Radiological imaging-based study. Cross-sectional body sections. Comparative species comparisons. Learn a region, overlay systems, use surface landmarks, read images in planes, and connect to clinical cases. Keep exploring, questioning, and learning. This is AJ's Anatomy. If you enjoyed the teaching, like, share, and subscribe for more videos. Thank you.